Welcome to Wednesday's edition of COVID-19. Authorities here have recorded a jump in daily infections with more than 600 cases today. Now, this unsettling upward trend is being witnessed in many other parts of the globe, and we have details on this later on in the program. Here first is our Kwon So-ah with the broader pandemic coverage. So let's begin with the latest here on the domestic front.
Yes, Sunny, the highest daily caseload in 3 months. We are seeing 668 infections were reported as of Wednesday, 12 a.m. And with that, domestic transmissions have also risen to the mid-600s with a slight drop in imported cases. And this rise here in domestic transmissions is from the high 400s just a day ago. And the total number of COVID-19 cases in the country stands at 106,898, with a death toll at 1,756. Now, amid this sudden surge, by-elections are being held this Wednesday under strict antivirus prevention measures. With Korea having had experience with voting amid the pandemic, we'll have more coverage on that with a reporter on site later in our program. Now, the capital Seoul, which is voting for a new mayor, has almost 200 new infections, and also Busan amid voting for a mayor here with 38 infections, also rising cases in many other places, 175 in Gyeonggi-do province, and all 17 provinces or major cities have reported new infections this Wednesday. So taking a look at the daily trend in infections, we are seeing almost 500 throughout the past week, and then here that sudden surge by 190 cases from a day ago. And with that, the average number of domestic transmissions now in the past week stands at above 500 for the second straight day. And questions are being raised on whether this is just a continuation of the third wave or whether we are already in a fourth wave of the virus. And here is the government's latest stance.
Today's case figure is in the 600s for the first time since January 10th, when the third wave was subsiding. We will have to monitor the situation a little longer, but the possibility of a fourth wave is gradually rising.
And to prevent a fourth wave, Yoon asked for 3 main rules to be followed by the nation's people. First, canceling any non-essential gatherings or reducing the number of participants, citing the high risk of COVID-19 infections from eating and drinking together, as face masks have to be taken off when doing so. Second, following basic prevention guidelines such as wearing face masks, washing hands, ventilating regularly, and getting tested for the virus if symptoms appear, stressing how these simple rules can reduce the dangers of the virus spreading. And lastly, the official asked for active participation in the vaccination campaign, in particular to protect the most vulnerable people in the community. And with that, let's also take a glimpse at the vaccination numbers. The number of people who have received at least one shot of vaccinations has surpassed 1 million, and our Kim Han-woo is going to get into the details in a bit.
Right. Meanwhile, on the international front, So-ah, Denmark looks to be the first in Europe to have introduced a vaccine pass.
Right, Sunny. Starting Tuesday local time, citizens in Denmark are required to use a new COVID-19 application to enter certain businesses, such as hairdressers or outdoor restaurants. And in a month from now, it's also going to be applied at indoor facilities once they reopen. This will certify whether a person has been fully vaccinated for COVID-19 or tested negative for the virus in the past 72 hours. So eventually, such COVID-19 passports should make it easier to also travel around the world. Now, the world is seeing almost 10 countries with at least 3 million infections of the virus. Let's take a closer look at the serious resurgences in some places. We're seeing India here with over 115,000 cases reported in the span of 24 hours. And also here, Iran saw its all-time high of daily infections and not looking better in Brazil, US, and Turkey as well. And the total number of infections around the world stands at 133 million, with over 606,000 new infections reported in just a day. And those are the updates I have for now. Back to you, Sunny.
All right, so thank you for the updates. Right, back on the domestic front, more than 1 million people here have received at least the first dose of the COVID-19 vaccine as of this Wednesday, as Swa mentioned earlier. For more on this and other related news, I have Kim Hanil here in the studio with me. Welcome, Hanil.
Good afternoon.
All right, then, do start us off with the latest on the local vaccine front.
Sure. So it's been 40 days since Korea started its vaccination program, and around 1,039,000 people got their first dose as of 12 a.m. earlier today. This is up by over 37,000 people from the day before, with around 2% of Korea's total population now having received at least one dose. In addition, over 33,000 people have now gotten their second dose of the AstraZeneca vaccine so far. Among all the vaccine recipients to date, close to 887,000 people have received the AstraZeneca vaccines, and over 151,000 have been inoculated with the Pfizer vaccines. 74 new cases of adverse reactions were reported yesterday, with the majority of them involving mild side effects. The rate of adverse reaction stands at 1.05%, meaning 1 in 100 people have experienced mild to moderate symptoms after getting vaccinated.
I see. Hannah, last week we spoke about plans to front-load AstraZeneca's vaccines in a bid to offer a greater number of people their first dose. Now I hear this plan is triggering concerns.
Right, so the Korean government is reallocating some AstraZeneca vaccines reserved for second dose to inoculate more people with their first dose. This has led to concerns over a possible shortage of second doses in the required interval between shots. This is what a top health official had to say regarding this matter.
백신이 이제 들어올 때 그 1차와
Vaccine shipments are not distinguished by first and second doses when they're brought in, but rather separated by lots containing a specified number of doses. We're trying to inoculate as many people as possible with the supply we have on hand through a flexible 8 to 12-week dosing interval for AstraZeneca vaccines.
He said the government is looking to expend as much of their current inventory as possible to administer more first doses and use shipments that are due to arrive in the coming months to meet the required demand for second doses. The official reassured the public that they are reallocating only a portion of the AstraZeneca vaccines while keeping the next shipment schedule in mind. So there won't be any shortages when the time comes for people to get their second doses. The recommended dosing interval for AstraZeneca vaccines is 8 to 12 weeks, while that of Pfizer is 3 to 4 weeks.
Right. Meanwhile, Hannah, what efforts are being made by authorities here to address the vaccine supply shortages?
Well, the possibility of curbing the exports of the locally produced AstraZeneca vaccines was not something that the government was considering before. But when asked about that subject yesterday, the government appeared to be more coy about it. Take a listen.
We are reviewing our options to procure the vaccines we need in the timeliest manner possible.
Her remarks may be open to interpretation, but it clearly struck a different tone from last week when the official ruled out the possibility of curbing AstraZeneca vaccine exports. Another option the government may be considering is producing more domestic AstraZeneca vaccines at the SK Bioscience factory and negotiating with AstraZeneca and COVAX to give Korea priority access to these extra vaccines. Also, the government said yesterday that its plan to inoculate 12 million people by June is still on track, despite a few setbacks, with vaccine shipments enough for 18 million people set to arrive within the first half of the year.
All right, Hanal, as always, thank you very much for that coverage.
Thanks for having me.
Right, also on this Wednesday, voters here in Korea are heading to polling stations to partake in by-elections. Now, following last year's legislative election, this is the second public voting to be hosted here amid the pandemic, and our Chun Song-cho is out on location. Hello, Song-cho.
Good afternoon, Sunny.
Right, so Songchul, do start by telling us where you are and about the safety measures in place against COVID-19.
All right, so I'm at a polling station here in Yangcheongu District, Western Seoul, which has been set up for the 2021 mayoral by-election. Well, this polling station is actually Sinol Youth Cultural Center, and now it's turned into a polling station. It's one of the 3,500 stations across the country which have started accepting people since 6 a.m. this morning, and they'll stay open until 8 p.m. today. Well, for this polling station, there are about 3,000 registered voters, and 500 have turned out so far, and that's excluding the early voters. So this election is by no means an ordinary one. It's taking place in the middle of a pandemic with a contagious virus lurking around. Everyone's attention is on how to prevent this virus from going around and infecting all of these people who have come out to vote, to perform their civic duty and to participate in democracy. But there are actually steps you can take, of course, to help you vote and also to minimize your risks in the pandemic. So let's step inside. So first of all, when you step in, you have to get a temperature check. 안녕하세요. So, all right, so I got a green light to step in. And then, of course, you'll be instructed to use a hand sanitizer to clean your hands. And the temperature check was so that to make sure that I don't have fever, which is a common symptom for COVID-19. And of course, you have to have your mask on at all times, right? That's no brainer. You should be wearing your face mask anyways once you step out of your home. And you can protect not only yourself and others by just simply wearing a mask, but you'll be asked to pull down your mask just for a brief time when the election officials have to verify your identity. So here, the officials will give me a pair of vinyl gloves. 안녕하세요. 네, 감사합니다. So I'll take these gloves, put them on, and walk into the polling booth. And there, you can just cast your ballot. Simple, right? So let's talk to one of the officials here to learn more about this election process. 안녕하세요.
Hello.
Good afternoon. All right, so what kind of disease prevention guidelines are in place here to control risks for the election operations?
All possible contact surfaces have been disinfected in advance. We minimize contact density by providing a separate entrance and exit. We also limit the number of the voters stepping into the same space, not exceeding 4 to 5 at a time.
All right, so you're putting a cap on the total number of visitors visiting this polling station. Thank you so much for your answer. Thank you. All right, so that was just a snippet of what election officials are doing here to really uphold citizens' constitutional voting rights and also public health interests, because we don't want this place to turn into a petri dish, a hotbed of viral transmission. Last year, South Korea successfully carried out a national election, a parliamentary election, without resulting in any new infections, and I believe we can do it again. This has been JUNCTURE reporting live from Yangcheongu District, and back to Sunny in the studio.
All right, Songchul, thank you for that report. Right, meanwhile, this past Sunday, Bulgarians cast their ballots at a parliamentary election amid a surge in COVID-19 infections. Now, for more on this, I have Mila Ivanova live on the line. Hello, Mila.
Hello.
Now, Mila,
Nice
do
to meet
start by telling us about the impact of the pandemic on Bulgaria's parliamentary election this past weekend.
Well, it's been a hard year for everyone here in Bulgaria, and the pandemic affected everyone's life. And of course, it affected the results of the elections. People showed their disapproval of the management of the corona crisis right now, and they showed no fear going to the election and showing this disapproval. So it was a surprise that the turnout was extremely high in the biggest city here in Bulgaria, and something that was even more surprising, that the people living abroad, the Bulgarian citizens living abroad, for the first time showed their will to give their vote right now. And the Central Commission did not publish yet the final turnout, but the number is higher than the previous elections in 2017.
I see. Meanwhile, Mila, I hear the pandemic situation in Bulgaria is looking quite bleak. Could you tell us a bit more about the outbreak there?
Yeah, right now we have a situation in decreasing the numbers of the corona cases, but we are still in the third wave. I want to tell you about the numbers, the exact numbers. So we have 3,860 newly infected cases, but 2,758 are the recovered for the last 24 hours. We still have 10,000 people hospitalized and 755 are under intensive care. But those numbers are showing some improvement over the last closing situation. We have our third term of lockdown. So this affected the numbers of the COVID situation.
I see. And Mila, what appears to be fueling the rampant spread of the virus in Bulgaria?
In my opinion, we have a very chaotic management of the corona crisis in loosening and tightening the measures. And I think that the lockdowns that were imposed here in Bulgaria were too short. I mean, in 10 days, we cannot have a real effect on the disease. So that is why people have lost the control over the disease. They are going out or they are still staying at home. Wearing masks is a little bit chaotic. We are obliged to wear masks only inside but not outside, and it can be visible. It can be seen very easily when you go outside in the main streets. People are living just as there is not corona crisis at all.
I see. Now, I believe COVID-19 vaccinations are also underway in your country. What has been the public response to the inoculation campaign, and how is it progressing?
Yeah, the vaccination program is underway, but we have a shortage of vaccines. The first deliveries of the vaccine have come in September, and the first people, those in the risking group, like elderly people, like teachers, like policemen, they were the first in line to get vaccinated, and even the people who organized the elections. But after this, we have a shortage of vaccines, and we had some mistrust for the vaccination process. You know, there were some cases with AstraZeneca vaccine they had these incidents outside, but in Bulgaria we did not have proven cases of death after vaccination process. Nevertheless, the vaccination process is very slowly and very clumpy. It's not getting very slightly.
I see. One final question, Mila, before you go. Last year, upon request from Bulgarian Prime Minister Boyko Borisov, Korea sent its test kits to Bulgaria. Now, how have the two countries been collaborating against the pandemic?
Yeah, the South Korean tests were delivered in the critical first months of the pandemic, and it was a question of great importance of the diagnostic capacity of the Bulgarian health system. Later, in additional amounts, the PCR tests SARS-CoV-2 were delivered, and we currently use them. According to the information of the National Center of Infectious and Parasitic Diseases, the quality of the South Korean PCR test is very high, but the most commonly used PCR tests here in Bulgaria are from China. Providing the South Korean PCR test so soon after the beginning of the pandemic was a very nice gesture of partnership. So South Korea remains a trusted partner for Bulgaria, and we are looking for further successful partnerships.
Right. All right, Mila, thank you very much for making the time to join us live at this very early hour to end.
Thank you very much.
I just worry that we will see the surges that we saw over the summer and over the winter again.
이번 한 주가 4차 유행의 길로 들어서느냐 아니면 일상 회복으로 한 걸음 더 나아가느냐 하는 중대한 분기점이 될 전망입니다.
연령이 높거나 기저질환이 있는 분일수록 감염 시 치명률이 높거나 독증으로 이완될 가능성이 높았습니다.
In our studio session today, we explore the factors that may raise one's risks of fatality amid COVID-19 infection and current vaccination efforts to fight the pandemic. I have Dr. David Kwok from Soonchuneng University Hospital. Good to have you with us, Dr. Kwok.
Good afternoon.
And I also have Professor Chung Sun-jae from Yonsei University. It's been a while, Professor Chung.
Yes, it is, and good afternoon.
Right then, Dr. Kwok, we are witnessing resurgences across Europe and in the US and possibly here in Korea. What do you believe is fueling this unsettling trend?
I think it's equally the complacency that we're having globally. But I think the situation is kind of a little bit different comparing our own country, Korea, to some of the other Western and the United States and the European countries, because it seems like there's more resistance for people to be restricted in the sense of socially distancing in the Western countries, as opposed to us. It's more just the regular complacency that we're having because we're still trying to follow these social restrictions guidelines. I wouldn't necessarily call a complete resurgence, at least in the US, but in the European countries and also in the US, with the progression of vaccinations, people have become complacent. And I've seen some footages where people are actually demonstrating against the idea of vaccination. And that we, in our country, in Korea at least, would consider rather absurd, because we are all really longing to be vaccinated at this point. So common factors that I've seen in the US and in the European countries, when they're loosening up their social distancing restrictions, the numbers go back up. And then they tie it up so that the numbers could go back down. But in the fluctuations of up and downs, they're still continuing to see rather mild decrease in the confirmation cases, because there's still progression of vaccination population. I think it's only a matter of whether they would be more willing to receive the vaccines now, that at the end or in the long run they would achieve much lower confirmation cases in the future. But in our case, in comparison, it'll be a little bit different, because when we do implement a certain level of social restrictions, our population tend to actually follow that better. I can't say better, but they're more willing to follow it. So globally speaking, I think people are really getting tired of all the ups and downs and all the loosening and tightening of the restrictions. So it's once again the time of the year where we need to just remind ourselves, it's that time that we need to go back to keeping our distances and keeping all the guidelines as much as possible.
Right, and being vigilant then.
Mm-hmm.
Professor Chung, according to researchers here, pre-existing health conditions, including high blood pressure, diabetes, and chronic lung disease, in that particular order, hold the greatest risk of COVID-19 fatality. Could you explain this finding for us?
Well, yes, the conditions, as you mentioned, the hypertension, diabetes, or the chronic pulmonary disorder is as known as the baseline conditions which increase the risk of the mortality or hospitalization from COVID-19. And this is not only limited to Korean population. Actually, this is known worldwide. And this phenomena has been seen similarly from the infections from other coronaviruses such as SARS or MERS virus. And mostly it could be explained by the imbalance of cytokines such as IL-6, TNF-alpha, or IL-7, and also some interruptions in the endocrine system such as the renin-angiotensin system. And this inflammation and cytokine imbalance can lead to cell damage and also the constriction of blood vessels, which may aggravate the lung damage in COVID-19, leading to poor prognosis.
I see. Now, another factor that can raise the deadly risks associated with COVID-19 is air pollution. For more on this reality, I have Professor Thomas Munzel at the University Medical Center Mainz live on the line. Pleasure to have you with us, Professor Munzel.
Good morning.
Professor, do begin by sharing with us the details of your research.
Actually, the important point was that during the first SARS-CoV-1 pandemic, the people already realized that with increase in air pollution levels, you get an increase in COVID mortality. And an interesting paper which was published by Francesca Dominici. She's also co-author on our paper. She showed that with an increase of 1 microgram per cubic meter, the mortality on COVID increases by 11%. Now, Lelyfeld and co-workers, if you want, our group, we calculated that around 15% of all COVID deaths are due to air pollution, which is a very high number. And this is easily explained because air pollution and the COVID infection are attacking the same organs. So the COVID virus actually goes to the lungs and causing, like the previous speaker said, a very severe infection and inflammation. And air pollution is doing the same in the lungs and in the cardiovascular system. So these are additive effects, and of course explain nicely why this is such a danger for people infected with COVID-19. So we have to reduce the levels, and I've seen the levels in Korea are pretty high with 25 microgram per cubic meter, and there are some studies showing if you bring it down to 12, which is the level of the USA, you can actually reduce mortality by air pollution by 50%. And we have also to keep in mind that with air pollution, excess mortality is around 8 million. Yeah? And we have now 4 million deaths due to COVID pandemic. So currently we have 2 pandemics, and this is very important to consider both together, not just COVID-19. And it's very important to have sustainability. Now the climate is getting better, less people die, but we have to keep the situation, and we don't have to get into a rebound when everything is, when COVID vaccination is finished.
Right. Professor, I hear that air pollution also greatly raises the risk of COVID-19 transmission. Could you explain this for us?
So this is, let's say, a little bit in discussion. So it's very important to know that this particle has a carbon core, and on this carbon core are sitting aldehydes, transition metals, endotoxins, and maybe also viruses. So there's in general a chance that these particles may act as a super spreader, but this is hard to demonstrate. At least there are some data showing that in these particles is COVID mRNA, so there is still a chance that with spreading the particle, we also spread the virus.
Professor Munzel, you mentioned this earlier, but fine dust, especially in the months of spring, is a major problem here in this part of the world, in Korea also. Having said that, what are your thoughts on its risks on Korea's COVID-19 outbreak?
Yeah, so I think when we have the data from US Lelyfeld also, who showed that during, let's say, this third wave or the severe lockdown, that 50,000 lives were saved in India and also in China. So I think we have to work very hard to bring down the levels. As I said, you have an average of 25 microgram per cubic meter, which is much, much higher than the one required by the WHO, which requires 10 microgram per cubic meter. So you have to do whatever you can to bring down your air pollution levels. And for me, it's interesting to see that the vaccination program is not working like it's not working in Germany. It's really a disaster, you know. You vaccinate a lot with AstraZeneca. AstraZeneca is to some extent out in Germany because we have these thrombosis problems. We have switched, saying initially this vaccine is just for the elderly people. Then we said it has to be vaccinated to the young people, and now we come back to the elderly, and so this is a big confusion, and we just don't have enough vaccination. That's a big mistake, and we suffer a lot under that, and we will get also a fourth wave for sure.
Right, hopefully in the future. All right, Professor Munzel, thank you very much for being with us live at this early hour with your thoughts.
Very good. Thanks a lot.
Right then, Dr. Kwak, the virus reproduction rate here in Korea stands at above 1 again, as daily infections have been surging in recent days. We're looking at 668 cases today alone. What are your thoughts on this trend?
Let me begin by stating my thoughts about the are not the representative number. It's really representation of either it's growing or it's reducing. So when it's larger than 1, it only means that number is increasing more than before. And when it is less than 1, it only means that it's reducing. So I don't think at this point, as long as it stays within a certain margin of error, if we're having R naught values of 1 point something, it's not going to give us anything completely different, drastically different from what we had before. Now, that being said, the number is still very worrisome. 668 is definitely not a small number. But if we look deeper into it, the composition, the cluster infection especially that we're seeing is not the usual cluster infection that we used to have before. It's due to a certain complacency we started having which was not seen before. What I want to mention is that a certain cluster infection happened because a certain person was reluctant to get tested when she or he was told to get tested, either via text message or through whatever the method that was be. And it spread to many, many others. And then there's the other cluster infection that's spreading throughout the nation from a religious sector that was probably in the stricter control because of the prior experiences that we had. So it's definitely showing signs of too much complacency we are having. I don't think that's going to be fixed anytime soon because, as I said before, we're all really getting tired of all these ups and downs and getting restrictions and getting loosened up again. And really, we're adjusting to how we're going to get away with sort of, not keeping the social distancing, but being safe. So we're all in that mode right now. I don't think government can really take stricter restriction at this point to have the number lowered again because people, again, will find their own ways to go around it, so to speak. I think we need to find better ways of transferring our message to the general public or to everyone, really, including myself here, that it's a tiresome situation. If we don't keep the numbers down low, it is really going to explode once again, and it may affect every single one of us. So we have to get the message across that it's not some fluctuation that we've always been having, but it's really our own individual problem that we need to take at our hands. So that's the situation that I'm facing with Korea at this point, really.
Right. Professor Chung, Korea recently recorded its first community transmission of the South African variant. Having said that, Professor Chung, what are your thoughts on the spread of variants here in the country?
Well, yes. Well, actually, the mutation known as a major mutation is originated from England, South Africa, and also Brazil. And we are more cautious about this South African mutant because it is known that they are less effective at certain vaccines for preventing the COVID-19. And from one article from the New England Journal of Medicine, they reported that the 2 complete doses of the AstraZeneca COVID-19 vaccine were found to have only like 10.4% efficacy against this the mild to moderate infection about South African variant. And the day before yesterday, KDCA has announced that the total of 330 people has this kind of major mutants. And also there was a new cases of 41 cases, and among them, the 10 cases were the South African variants. And what we know is that there were 22 domestically transmitted variants, and of them, 5 of them were from the South African variants. And what we are mostly concerned about is that we don't know, some of them, we don't know the exact route, how they get infected. So by that, we may suggest that there will be more community transmission about this severe variant among our community.
Right. Dr. Kwak, authorities have claimed that if the number of vaccinated people hits above 10 million by the first half of this year, the outbreak here on the local front can be contained to a certain degree. Can you explain this for us?
I think their statement is more based on their hopes. I think it's rather weakly scientifically grounded because there were no clinical studies that have been done so far that proves if the minor percentage of a population is vaccinated, they will certainly start to show a sudden reduction in the numbers. But the KDCA is stating that we would be better off if we can get at least 20% of the population vaccinated. It's, I think, based on some recent findings that those elderlies who were vaccinated inside the nursing homes, at this cluster infections that we're currently seeing, at least they were not affected. So they're trying to, they're actually maybe speculating that if we had at least a certain percentage of, whether that might be minor in the composition, if they cover a certain percentage of the people, at least that would show effect. Of course it will. Numerically speaking, calculations, and mathematically speaking, if we cover some people, that some portion of the people will give the appropriate effect to the society. So if we cover enough 20% of the population, we might have 20% of the effect from that. But I would not necessarily say that if we cover up 20% of the population, that would suddenly start to show 90% of the immunization, immunity in the population. So that being said, though, we still need to get our hands on as many vaccinations as possible because it's probably the only way we can get out of the current pandemic at this point. Maybe sometime in the future, I'm having my fingers crossed that we would come up with some other methods to fight against the virus, such as antivirals and some antibody therapies maybe. But at this point, vaccination or vaccinating as many people as we can is the only way we can fight that reduces the number of confirmed cases in the future. So in regards to covering up at least hundreds of thousands of people, I think it's a little too early to say that, oh, this certain number of immunity will suddenly protect us. It's more that we need to still progress very quickly, as quickly as possible, to cover up the major portion or major proportion of the whole population as fast as we can.
Do we have an exact idea of how long these antibodies last in our bodies, those induced by vaccines?
Mm-hmm. So the only recent study that I came across with is one study that showed up to 6 months of protection from the antibodies achieved by vaccination. I believe former studies that claimed up to about a year of possible antibodies protecting us, I don't think they really showed clinical results that were legitimate. So up until this point, because only a very short amount of period has passed since we actually started to have clinical trials of having people vaccinated, only up until now, about 6 months is what they claim that they can protect us. Maybe in the future, if enough time again pass, we'll see lengthening of those periods, and maybe we'll be able to see maybe a year or two afterwards.
Right. Now, in the meantime, Professor Chung, in order to offer the first dose of the COVID-19 vaccine to at least some 12 million people by late June, at least 130,000 people need to be vaccinated each day starting now. How feasible is this plan, keeping in mind the global vaccine shortages?
Yes, actually, as like Dr. Kwang said, we are facing the shortage, and that is real. And that is like the very same in the Bulgarian situation and all the other global situation. We are having the shortage of these vaccines, and I don't think we can make this very, adequately. And also, their supply from Covet's facility was proposed to be like 690,000 doses, but this was reduced to as like the 430,000 units. And this was also delayed for like 3 weeks. So we are actually having this kind of shortage. And I think this government, the newly announcement about the second quarter vaccine program, which they will remain the AstraZeneca interval as 12 weeks, which was like 10 weeks before. And I think this was to operate the more flexible schedules because of this shortage of vaccines. It's my personal opinion. So, the government is trying hard because they are doing this kind of direct government manufacturer contracts, such as the Moderna, Janssen, and Novavax. However, this global shortage of the vaccine would not be sufficient to cover this. So, as an individual, I think the best way is to get your vaccine as soon as possible when you are in turn. And I think this is the only thing we can do.
Right. And then what other options does Korea have, Dr. Kwak, as part of efforts to ensure adequate vaccine supplies then?
And again, from me, it's also my personal opinion. I'm thinking rather more in the theoretical region here. Because we're already dealing with realistic numbers of vaccinations we got on our hands, and that's clearly lacking. The only way to get around it is to maybe start manufacturing more with the grant of the actual companies such as AstraZeneca or Pfizer per se. But so since we have on our ground the manufacturer of these vaccines, instead of claiming that we could restrict the export to other countries, maybe we could increase the amount of manufacture and start, tenfolds of the amount that we used to manufacture and start distributing some part of that to our own people. But also at the same time, we still need to keep contacting all these different companies all around the world and try to still get our hands on whatever we can, whether that be Pfizer or Moderna or Johnson & Johnson Janssen, or whether that be Sputnik from Russia. If they're shown effective, then we need to keep contacting them to send us over. Number two, I think vaccination is not the only answer to the fight against the virus. We should also keep studying how well we could do with treatment regimens, such as antivirals that are being studied all over the world. Also, antibodies. Even on our own country, there's a huge company that claims that their own antibodies can have a very great efficacy. I'm not saying that they are, but we're saying we need to keep studying and researching to come up with our own treatment regimen so that when vaccination is not covering the 100% of the immunity, we can still fight against the virus in another method. So when there's no sword that we have at our hands, we could still fight with the shield against a certain attack.
Right. Professor Jung, staying with what Dr. Kwak has said, he mentioned Janssen's vaccine as well. What can you tell us about Janssen's product?
Yes, from the Janssen's report, they said there was a 66.3% of the effectiveness in the clinical trial for the preventing COVID-19. And also, this is a virus vector vaccine like the AstraZeneca. So the people would have like the most protection efficacy at 2 weeks later from the inoculation, as like in the AstraZeneca. And the vaccine showed high efficacy in preventing the hospitalizations and also death, and some proportion of the asymptomatic infection too. However, it can also cause a side effect, as just like our previous two vaccines had, which will be like the myalgia, fever, or the headache or nausea. And if this kind of symptoms appear, then the treatment is the same. Take the analgesics like Tylenol and maybe wait for 2 or 3 days, and they will mostly gone. And however, I'm very glad that if we have this vaccine again, and then we have the third choice. And we have more vaccines as possible as we have. And this needs only one shot, as been previously mentioned, so it'll be more convenient to a lot of people to get the prevention from COVID-19.
Right. Dr. Kwak, as our SWA mentioned earlier, Denmark looks to be the first in Europe to introduce the vaccine pass. Do you suppose implementing such a pass may perhaps better promote public inoculations against COVID-19?
I think in some cases it would actually mandate certain people to receive the vaccinations. One of my friends, a close friend of mine who's a pilot, told me that there is a consensus globally that all these airline carriers are going to mandate all passengers to have these vaccination passports if they want to board on the plane. So yes, they would definitely promote having people vaccinated before going abroad at least. But if we also implement that to the domestic flights maybe, then a lot more people will start to get vaccinated even if they didn't want to before.
Right. And do you suppose this kind of plan, Professor Jean, would perhaps deal with the presence of variants here in the country?
For that, maybe we have to have more data for that, because we don't have any kind of real evidence right now about the variants, because I told you that the number of the variants is relatively, small, because to have this kind of sufficient powered study, so maybe you have to wait for more.
Right. Now, Dr. Kwak had earlier said that instead of strengthening our social distancing guidelines, we need to perhaps spread the word, raise awareness about the danger of COVID-19 to the public. What are your thoughts? Should we strengthen our social distancing guidelines, or should we seek week more to focus on raising awareness about the dangers.
Well, I totally agree with Dr. Kwok's opinion because, as I mentioned earlier, we have kind of a mental potentials to take all the message and keep ourselves alert. And just keeping yourself alert always, like 365 days would be, it would be not possible. So, as a citizen, we need more kind of efficient messaging and more kind of the other ways to deal with this kind of public alertness.
Right. All right, Professor Chung, thank you very much for your thoughts. And Dr. Kwok, thank you very much for your insights.
Thank you.
Right, medical experts say failure to rein in this latest resurgence will negatively affect hopes for herd immunity to fight the pandemic this year. So do seek to take care. Thank you for watching.
With COVID-19 vaccinations rolling out, we can see the first rays of hope for an end to the pandemic. Similar to other vaccines, the body may exhibit a variety of immune responses after receiving the COVID-19 vaccine. Common responses to COVID-19 vaccination include pain at the site of vaccination, accompanied by mild fever, along with soreness, headache or fatigue. These symptoms occur because the vaccine triggers an immune response in the body, but they typically subside after 2 to 3 days. With this in mind, the Korean government is strongly encouraging companies and employers to grant a vaccine leave for those who get vaccinated. Vaccine leave allows people who have received the vaccine to take a day or 2 off of work without a doctor's note, encouraging more people to get vaccinated without worrying about how it might impact their jobs. Now, the government and citizens must both work hard to ensure a faster, more effective vaccination effort. Overcoming COVID-19 together, let's stick to the basics.